Hi, everybody. I'm David Martinez III, the Director of Community Engagement for Vitalyst Health Foundation. Thank you so much for joining the FY22-23 Systems Change Grant Information Session. Thank you also for those that are showing up live the Friday afternoon before a Labor Day weekend. Not the best planning on my part, but we really appreciate you taking some time to learn more about our System Change Grant cycle this year. We are recording this and we'll post it to our webpage for those that have hit the road early for a hopefully safe and healthy Labor Day weekend. We'll go ahead and get started with a couple of housekeeping. All lines are muted upon entering the webinar, so just keep that in mind if you go off of mute. We will have a Q&A session at the end, so you can unmute yourself. But definitely use that chat room function to ask questions as they arise throughout the webinar. I have a couple of my colleagues that are tracking those questions and we'll be answering them live via the chat room. And we'll certainly have time at the end of this for a live Q&A chat and be able to capture those questions that arise in the chat room as well. We'll be taking all of those questions and compiling a FAQ form that will be put onto the Vitalyst Health web page, grants webpage. Also, these slides and the recording for those that aren't live with us. We also are trying to practice a bit more accessibility and inclusivity with this informational session. So we have the closed captioning options available for those who need that. And we have a Spanish translation capability, not for this live translation of this information session, but have bilingual Vitalyst staff members that folks can reach out to for specific questions. And I'll turn it over to Virginia really quickly to speak to that.
Good afternoon, everyone. Buenas tardes a todos. If you need help in Spanish, please feel free to send us a message and we'll be happy to respond. Si necesita ayuda en español, podemos ayudarla también con eso. Pueden enviarnos un correo al email que ve ahí, que es conversemos@vitalysthealth.org.
Great, thank you so much. Thank you again for joining us. I'm David Martinez, as I mentioned, the Director of Community Engagement for Vitalyst Health Foundation. I am now in my second Systems Change Grant cycle, overseeing our grants program at Vitalyst Health Foundation, and I'm so excited to present to you some updates to that Systems Change Grant. So if you're familiar with Vitalyst and our grant cycle, you might not see too many changes, but hopefully some improvements based on the feedback that we have received from our existing grant partners, from community partners, consultants, and just as we work to improve the type of trust-based philanthropy and relational grant making that we hope to practice here at Vitalyst Health Foundation. We have a whole team that is ready and willing to work with you to explore systems change grants this year and just greater partnerships throughout the year. But familiar names and faces and emails that you'll see and hear from specifically for our grants, systems change grants, include Kelsey Ahn, our Assistant Director of Partner Engagement, as well as Virginia, who you just heard from now, who will stay connected with our partners and be able to facilitate conversations as we move forward through our grant cycle. A lot of folks are familiar with Vitalyst, but if you haven't, welcome. So great to connect with you. I am now in my going on 4th year working at Vitalyst, and I've just been really appreciative of everybody's insights as we continue to grow as an organization, but we are still certainly committed to ensuring that all individuals and communities in Arizona are healthy and resilient. We do so by connecting, supporting, and informing efforts that improve the health of individuals and communities in Arizona. And as some of you have participated in our strategic roadmap refresh this past year, you might see some new ways that we're reflecting our work. We have 3 refined goals at Vitalyst Health Foundation that better describe how we achieve our work with you. We, as many of you know, work towards systems change, that upstream approach to improving health, and that takes a village. So we want to specifically support collaborative networks that are working to improve the conditions that impact health, all the while recognizing that those collaborative networks are made up of a lot of smaller or individual organizations. We want to ensure that they themselves, those community partners, are strong as well, especially equipped to advance health equity. And because we work toward systems change, that often involves policy and advocacy. So we work specifically to inform decision makers and especially prioritizing community health and well-being. Again, holding that health equity lens as well for those communities and populations that face the greatest disparities in health outcomes. We have a really broad portfolio at Vitalyst, but have gone through a process to identify organizational priorities that we specifically have specific and intentional activities, more so programmatically, research, convening, advocacy, and policy specifically related to these 4 priorities of civic health, food systems, housing, and healthcare integration. And we have directors that oversee each of these 4 priorities. Still, we want to engage and partner, be responsive to community needs throughout the state of Arizona, even outside of those 4 priority areas. So we have an open door policy at Vitalyst, and I've set up and improved what we call our discovery process. This is an open intake form for any organization that wants to explore partnership broadly with Vitalyst Health Foundation. And you'll be hearing a little bit more about how we're going to use this discovery process to learn more about your ideas and concepts, your proposals for systems change grants specifically. That discovery process helps us explore the variety of different resources that Vitalyst has, including the Spark grant, the Systems Change Grant, which we'll talk a lot more about today, our technical assistance grants that work to build the capacity of community-based organizations and coalitions, our medical assistance grants, which we'll learn more about next year as we open up that RFP process, and our advocacy and public policy grants that specifically build the capacity of nonprofits that align with Vitalyst's own legislative agenda. So we have a variety of different resources at Vitalyst that hit on a lot of different arenas, all of the elements of a healthy community, affectionately called the wheel. We use this to not only guide our work, but showcase how important it is for community partners and collaborative networks to look at the intersections of the elements of a healthy community, a really important aspect to as we embark on a lot of different efforts to improve the health of Arizona and our communities. A lot of opportunities to partner, a really big proposal, but for today, we are launching our FY 22-23 Systems Change Grant. Again, if you're familiar with this grant cycle, there's not much new to our grants program per se. We just have reframed and improved the messaging a little bit better. So our Systems Change Grant is a 2-tiered grants program that includes the Systems Change Grant and the Spark Grant, specifically meant to support those collaboratives that are working towards systems change. And we'll take a deeper dive into each of the criteria, but that systems change can look a lot of different ways, including policy, actual systems, or environmental changes. These are 3-year awards, up to $175,000 total, and this year we'll award up to 4. The process that we're following for our systems change grant hasn't changed too much either from previous years. We're opening the grant cycle today and our online portal where you'll be able to submit your letter of intent or your LOI. Those LOIs are due in just about 2 months by October 28th at 5 p.m. Mountain Standard Time, Arizona. Then we go through our internal review process with the Vitalyst team, and by December 9th, we'll invite select LOIs to submit a full proposal. Those full proposals are a little bit much more in-depth application to better clarify what content was in those LOIs, and those full proposals are due January 27th of 2023. Our One mechanism in which we hope to infuse an equity lens in our grants process for our systems change grant is to not only rely on the full application or the full proposal that collaboratives submit, but match that and also assess the proposals through presentations. So we'll be inviting those full proposals to present, maybe virtually, maybe in person. We'll see how things go the week of February 13th for those proposal presentations. And then we continue to go through our review process with the Vitalyst Board of Trustees. They ultimately consider and vote on the awards that'll be then notified of actual grant selections on March 27th of 2023. Our systems change grant criteria hasn't changed either from previous years. We look at these 6 factors when we're thinking about and assessing systems change grants, the LOIs, and the full proposals. Our systems change grants are meant for collaboratives that are working towards systems change with a specific health outcome and a health equity lens. Obviously, a budget that is consistent with the proposal, and a budget and a solution that is sustainable beyond the grant funding and the grant period. And I'll take a deeper dive into each one of these grant criteria now. So the collaborative aspect of our systems change grant is recognizing that systems change is a heavy lift. This upstream approach takes a lot of work, and it's often a lot of work that goes beyond what just one organization can do. It takes a village, so it takes that can be through a collaborative or coalition of partners that are working together to tackle their specific systems change efforts. Some efforts, specific points that should be considered in the LOI is that the lead applicant needs to be an Arizona-based nonprofit, and that collaborative needs to be serving Arizonans. We also are totally fine with the lead applicant being a fiscally sponsored organization, though I will note if it is a lead applicant that is not yet a registered 501c3 and wants to explore being fiscally sponsored by the Vitalyst TAP-AZ program, that's a separate application process that has to be approved before it's noted as a TAP-AZ fiscally sponsored entity. The collaborative should be 2 or more community partners that are clearly identified, as well as their roles. And that kind of goes to the characteristics of the partnerships that we describe above in this section here. Not collaboratives that are just formed. These collaboratives should have had meaningful engagement already. They are at the table. They are have an existing partnership and ready to really roll up their sleeves and get to work on the proposal that's reflected in the LOI. The lead applicant and the collaborative partners should also have experience in the specific systems change and with the identified population that is covered in the LOI. So we look at not only the strength of the collaborative, but their readiness to and their experience to work in the systems change arena and with the specific systems change proposal that is in the LOI proposal. So the first criteria that we assess as part of the systems change grants LOI in full application is the collaborative. I also want to point out for each of the specific points that we're reviewing for each of the criteria, these are the same questions that the Vitalyst staff and board use as we review the LOIs and the full application. So we have streamlined that content so you know exactly what we're looking for, the exact rubric that we're using when we're reviewing the LOIs and the full applications as a way to ensure that there's an equitable practice and we're reducing as much implicit bias in our grant review process. Those collaboratives should be working towards systems change. We call them system change grants because that is the goal. The systems change is supported, the system change proposal should support efforts that shift the conditions that are holding the problem in place. Systems change can look like a lot of different things, and sometimes this is really challenging to see bigger picture, especially when it's more than just a policy change. We frame oftentimes systems change as policy, systems, or environmental change. But what we're specifically looking for in your LOI and when you're clarifying the type of systems change you're working to improve, we really want it to be as clear as possible. Systems change should be looking at the root causes or the barriers to the system or the issue that you're tackling. Obviously, working in the effort to improve the health of our communities. System change, as you'll see in a visual in a little bit later, can create really transformational change, but it can also impact relational or structural change. And there are different components of systems change that are reflected in each of those types that we'll dig into a little bit later. The LOI should be include how the proposed system change is feasible, and we want to ensure that we have a lot of dreamers and a lot of passionate people in Arizona that are doing a lot of great work, but we certainly look at and assess the feasibility of the system change efforts and want to ensure that your LOI also has a clear description of the proposed systems change and how it improves the way that the identified system itself operates. So to clarify a little bit more about what we mean by systems change, we refer to this visual and the resource that's linked there. A perfect type of systems change that is enacted and sustainable beyond time includes each of these 6 conditions, but sometimes we recognize that maybe 1 or 2 or a few of them are included in this specific proposal. So a lot of times we reflect on the policy or practice changes that can be impacted by the system change grant efforts. Those are kind of the structural changes I was talking about. But we also have seen past systems change grant partnerships that really tackle the power dynamics or relational changes, or even the mental models, transformative change that is included as part of types of systems change that we have supported in the past. So if you don't have a specific policy or practice that you're hoping to enact or retract at any level of government, say, you might have a focus on more of the mental model, and that would be included as a systems change as well. It would just be really important for you to clarify that as much as you can in your LOI, especially because it's a little bit harder to see as a systems change, whereas a policy or practice is some of those like more tangible concepts. To help kind of guide and clarify system change as well, we often use this visual to reflect our approach to improving the health of communities, taking in mind the elements of a healthy community or those social determinants of health. So Vitalyst works really in the upstream mechanism as seen in this visual to improve health. Our systems change grants support upstream efforts to improve health rather than the downstream approach. So for instance, the best example that I use, because I came from the food banking world, is the systems change grants do not support direct programming or direct service work like delivering emergency food boxes. Rather, they would support in the food system world, in the food security world, supporting food system coalitions or efforts that impact, say, the food system broadly, rather than direct service or programmatic efforts. So systems change should be in that upstream category, working to improve community conditions and the various tactics that are listed there, including policy changes and other categories or conditions of systems change as well. The third criteria that we're working to support with our systems change grants is obviously for health outcomes. We are a health foundation. Our systems change grants is looking to work with collaboratives to change the system that has a specific health outcome. So this is a way in your LOI that you align with Vitalyst's mission to improve the health of communities and people throughout the state of Arizona and show that intersection with the elements of a healthy community. That's the will that we referred to earlier and that we'll touch base on in a little bit as well. As many of you know, Vitalyst sees health as more than just healthcare. We see that broader social determinants of health, or what we call the elements of a healthy community. And those include a variety of different factors, not just healthcare, but certainly if you're collaborative working in that healthcare space, we can still explore partnership. And the specific points that we're really looking at in your LOI is that health outcome is really clearly identified, that the health outcomes are framed in health disparities language. We hold a health equity lens, as you'll see in a little bit as well. So efforts that work to improve the health of especially those communities that face the greatest disparities in health is something we really look at. The health outcomes for a specific population is really important to highlight in your LOI as well, and then how that the systems change would be would improve the identified health outcome. A key aspect and specific point to submit for your LOI is also to reflect on how the different types of elements of a healthy community are intersected with your proposal. So Vitalyst really looks at that will and more so focuses on the center of the will and how each of those elements intersect with one another, because that's how we can really tackle systems change and break out of the silos that traditionally restrict us from making the transformational change that really needs to happen for us to improve health at the root cause and for the long term. To reflect a little bit more about health outcomes, health is more than just healthcare. This visual shows that 80% of health are non-medical factors. So we proudly work with collaboratives across the state that are focused not just on healthcare, that 20%, but the health behaviors, the physical environment, and those socioeconomic factors that impact a person's ability to live a healthy life. And again, this is the elements of a healthy community will that Vitalyst promotes. You could see the variety of different social determinants of health. And again, in your LOI, you should present how your proposal has intersections of each of these elements, not each of the elements, but multiple elements of a healthy community will. You might be familiar just with the visual of the will itself, but on the link that's included on this slide, you'll see a broader handout that better describes each of these elements of a healthy community will. So you'll be able to see yourself, hopefully, and your proposal in each aspect of, in certain aspects of the will, and highlight that in your LOI submission as well. New this year as well is a different take on the elements of a healthy community will. This is a new initiative that Vitalyst has embarked on in close collaboration with the Intertribal Council of Arizona, or ITCA, and in specific collaboration with 17 tribes across the state of Arizona, recognizing that the will that we just presented on reflects more of a westernized medicine approach or health approach to improving healthy communities, and working with tribal communities across Arizona, develop this new healthy tribal community will. And I specifically wanted to highlight this. And again, the link on the slide has a bit more in depth for each of those elements included on this tribal will. But we, again, especially want to work with those communities that face the greatest disparities in health, and our friends in tribal communities across Arizona certainly are facing those as we have seen throughout the pandemic. So we wanted to especially highlight this new tribal will that can be reflected, especially if you have a systems change proposal with tribal communities. The next criteria for our systems change grant is that it needs to hold a health equity lens. This is really core to Vitalyst work. We hold a health equity lens in our own work and inspire others to do so as well through our systems change grants and all of our other grant programming as well. So what does this look like? We know that equity is both a means and an end, so either the perspective or the approach to your work, but there are key aspects that we're really looking at when evaluating or assessing the systems change grant LOIs and full proposals. One, we want to ensure that the project itself utilizes a health equity lens in their work. So that can be by engaging the people that are most impacted by the health outcome or the greatest disparity that you're looking to tack, and that they're at the decision-making table. They're not an afterthought. Those closest to the problem are closest to the solution. That community-centered perspective should be clarified in your LOI as well. The systems change proposal that you should be working on if you're submitting an LOI reflects that the impact that it will have on those communities, and that it really is culturally relevant to those being served by the project. And for a visual on health equity, a lot of folks may have seen this or a similar one with the baseball stadium. This shows the difference between equality and equity. It's really about meeting people where they're at and providing them the services with them, recognizing that there are disparities in health. And if we take a more equal approach, it's not adequately addressing the specific needs of that population or communities. The fifth criteria is the budget. These are 3-year grants of up to $175,000. So you'll have an opportunity in your LOI to submit a separate budget spreadsheet so you can outline how you intend on utilizing the $175,000. As we assess the budget, we really looked at it's consistent. The proposal is consistent with the grant amount, recognizing that you might need more as part of your total systems change, but what specific aspects of your LOI would be covered through this grant amount, and so clarify that. Also ensure that the budget narrative that you can accompany the budget spreadsheet with adequately reflects any additional aspects of your budget that need to be clarified. We also want to clarify that there are certain things that are not allowable through the systems change grant, especially capital expenditures like buildings or equipment, but we can have conversations if your collaborative includes for-profit entities or specific lobbying expenses. So in a little bit, we'll review how you have those follow-up conversations with staff to really clarify what is or what is not allowed for our systems change grant. And then the last but not least criteria for our systems change grant is sustainability. We know that a true systems change is sustainable in the solution itself is sustainable. This is really important to clarify because it's not so much focused on the sustainability of the effort budget-wise, but the fact that systems change should, if indeed changed, should be done after the change is made. This is most easily seen through policy and practice change as an aspect of system change, because once a law is enacted or retracted, the system change is done. So you don't need sustainable support per se for that change. So we want your LOI to really address how your proposal is sustained beyond the grant period and this grant funding, and really aligned with the concept of systems change being sustainable. So we've just reviewed the 6 criteria for our systems change grant: collaboratives, working towards systems change with a health equity lens and a specific health outcome, a budget that matches the proposal, and a sustainable solution within that systems change. So what happens now? We really are excited to discover if the systems change grant is the best Vitalyst support to leverage for you at this time. Meetings aren't required, but if you would like to review your idea, your concept, or look at strengthening your LOI, Vitalyst staff are available for phone or Zoom conversations, and we ask that you just bring to that 30-minute session really thoughtful ideas. It's not an ideating phase. It's not a brainstorming session with Vitalyst staffers. It really is to help you review your existing proposal and see if the systems change grant is indeed the best resource for you. If you're already working with the Vitalyst staff member, definitely continue that to work with them. You don't need this additional meeting. This is one type that we have, one aspect of the system change grant that we have changed this year. So it's much more based on relational grant making. So as you explore the systems change grant, you'll be directed to have a conversation with the Vitalyst team member that would make most sense based on your proposal. So for instance, if you're a collaborative working towards some sort of systems change in the housing space, you would talk to our colleague Gabriel Jaramillo, who oversees our housing priority at Vitalyst as part of his role as Director of Healthy Communities. I'll field general conversations about our systems change grants, but this is one way that we want to be accessible to our community partners and walk through your idea before you spend time to draft and submit a 2-page LOI that might not be a good fit for systems change. This process also ensures that we are leveraging the appropriate or the best Vitalyst resource for you, if not the systems change grant. So I mentioned the discovery process. That is what we're using to discover if systems change grant is the appropriate Vitalyst support. So you can schedule a 30-minute chat with one of our team members by going to that link, vitalysthealth.org/partnering with Vitalyst, with some dashes in there. And when you complete that intake form, select systems change grant as the type of support that you're interested in. We'll provide feedback to help guide the development of your LOI if that's what you decide to do. And in your LOI, we really want it to be specific and use it as a stepping stone to ultimately perhaps submit a full application where you'll have the opportunity to expand a bit about your specific systems change proposal. And LOIs, of course, are due by Friday, October 28th at 5 p.m. Arizona time via our online portal, which is an online portal that hasn't changed from our previous years. You can access a how-to guide on that link that's on the slide, and we'll post these links onto our webpage. Some specifics about the letter of intent. They are 2-page LOIs. That does not include the budget or the budget narrative. Those can be, those are additional documents not included in the 2 pages that we hope you clarify those 6 criteria points. Actually have a 2-page be typed and single space, 12-point font, so we can read your great proposal in these commonly used fonts with a 1-inch margin, and we accept a variety of different types of files like PDF or DocX, TXT, JPEG, or PNG. And throughout any of this process, if you don't know who to reach out to, just send an email to grants@vitalysthealth.org, and that'll be facilitated to the best person to answer your question as you're going through the LOI submission process. But if you have an existing contact with another team member, that's certainly an option too, and we'll share our contact information readily available as well. For those familiar with the Vitalyst grants programs, you might think, what happened to the Spark grants? As I mentioned earlier, our responsive grant making is a 2-tiered grants program. We just reviewed the systems change grant, which is the cycle that's opening today, and that the 2-page LOI is due by October 28th. Our Spark grants are still a grant resource that Vitalyst is leveraging, but the biggest difference with this one is that we have removed the grants cycle. So it's still meant for collaboratives working towards systems change that just need a little bit of planning. So this is a 1-year award up to $25,000. And we have funding for up to 12 awards in this fiscal year. But rather than have a grant cycle that starts after the systems change grant cycle. We're exploring these through relational grant making throughout the year, and our board is reviewing and approving these grants quarterly. So as we have conversations or a discovery process with you for the systems change grant, it might be determined that you would be better suited for a Spark grant. So we would refer you to that process, and you'll still work with a particular Vitalyst staff member who will walk you through that internal process to advance your particular Spark grant proposal for our internal Vitalyst team review and ultimate approval by our board of trustees. So it's a little bit different than previous grant cycles, but a way that we're trying to be more responsive to community needs, and also reflecting that systems change always doesn't happen in a grant cycle. So that's a change for this year, but the content, the criteria itself hasn't changed. So that was a lot of information in 40 minutes, but hopefully it provided some clarity to our systems change grant, the criteria, and the submission process for the initial step of the 2-page LOI that is now open and due by October 28th. So I'll stop sharing and bring it to the full group now. And I saw the chat room bubble blazing throughout the chat. So we'll turn to my colleague, Kelsey or Virginia, to raise up any questions that perhaps wasn't covered in the chat room and that we want to raise now. And then after we get through those, we can do an open Q&A session now. If you just click on the little reaction button and raise your hand, we can get a queue going on that front. And if we run out of time today, remember, we are accessible. Just go to that discovery process and select system change grants, and you'll be prompted to schedule a time for us to chat and answer more specific questions. Thank you for your time. Kelsey or Virginia, do we have any questions to answer immediately?
Yes. One of the questions that came through was, should a specific systems change be identified at the beginning of the proposal, or can it be determined at the end of a research project?
Great question. The specific intervention or solution towards systems change for the system change grant should be identified and ready to be implemented. Our 2-tiered grants program was built specifically this way. So these are 3-year grants for those collaboratives ready to go. They have their intervention or solution identified. They just need multi-year funding to help get it done. If you're still in the research phase, you might be better suited for the Spark grant. But keep in mind, the Spark grant isn't meant just for research phase. It should be specifically tied to a specific policy, systems, or environmental change. But we can certainly walk through specific opportunities with you in a one-on-one conversation.
Another question that just came through, can local government be the lead? If not, can we be part of the collaborative?
Yes, absolutely. Local government can be the lead and can certainly be part of the collaborative. We highly encourage the lead applicant to be as much as possible a community-based organization, because if you recall, during especially the health equity criteria, we really want those closest to the problem to be closest to the solution. But we have seen a lot of proposals and systems change grants awardees actually be inclusive of institutions like government at all level, and then also educational institutions as well. We allow the lead applicant to be those types of institutions, but still really encourage you to work more closely with your community organizations and community partners to try to put them in the lead position to hold that health equity lens.
The next question is, can you provide some examples of previous systems change funded projects?
Ooh, this is the fun part. On the website, on the vitalysthealth.org website, you'll see a complete listing of all of our systems change and Spark grants from previous years. So you can take a deeper dive into what we have funded before. That's always a great resource because those have been vetted, board approved, you can get a sense of where we're at with what we approve and what we mean by system change and have supported in the past. I am so proud of the new class of system change grant partners that we have from this past year. We have 4. And for the first time in Vitalyst history, none of them are from the great state of Maricopa County. I'm originally from rural Southern Arizona, so really am proud that 3 of the 4 grant partners are from Southern Arizona. 1 is in Yavapai County. Our good friends at Steps to Recovery Homes is working specifically to improve the coordination of care system in Yavapai County for especially those community members that are impacted by substance use and are working to improve their lives in that way with that wraparound service. So that is one specific example that I'll highlight. But if you go to our website, you can see all of our grant awardees from previous years.
Another question is, can a portion of these funds be used for C4 or policy and legislative work?
The funding cannot be used for C4 work, but let me gain clarification on that and we'll include it in the FAQ document. The funds can be used for advocacy and public policy support, including direct and grassroots lobbying. But let's definitely have a conversation on that because we want to ensure that the proper regulations are followed when it comes to especially nonprofits engaging in those types of activities. There are specific rules that we certainly want to keep you on the up and up about.
Rachel, to answer your question, this PowerPoint will be available afterwards on our website. Sergio, our colleague, is going to share the link. And then I know Rodney has the hand raised, so can we toss it over?
Sounds good. Yes,
question?
Rodney.
Thank you, David. Sorry, I'm in the field here, so not the most attractive place to be. I was wondering if you had any more guidance to share with us about, towards the beginning of the presentation, you talked about how most of these collaborations, these several collaborators should be already established. So if you could give us a little bit more guidance around that. So for example, you could have a collaborative that launched yesterday or 3 months ago or a year ago or 2 years or 5 years ago. Is there any more clarity on what sort of is the measure that you have on that?
Yeah, that's a great question, Rodney. Thank you so much. And thanks for your work out in the field. This is a really important question to clarify, especially because, as mentioned, systems change is hard work and it does take a village. It does take more than one organization. That's why we have a specific grant criteria area around the collaborative or coalition. It is 2 or more organizations, and there is no kind of red line, if you will, with say the length of the collaborative partnership. But I will say, if it's just meeting yesterday or maybe even this year, it's a kind of like Johnny come lately concept. You're probably not yet at the stage of a system change grant, but perhaps the Spark grant to allow that collaborative or coalition to spend that year's worth kind of forming a little bit more. I'll also note the specific points that are noted in that collaborative slide of the PowerPoint is how we assess the 2-page LOI. But for those LOIs that are advanced and invited to submit a full application, the full application includes a more thorough assessment of your collaborative using a tool that is called the Wilder assessment. It's a pretty commonly used and accessible assessment. And it's a pretty thorough question that each one of the partners has to answer to gauge the strength of your collaborative. And those questions look at the trust that is there at the collaborative, the length, and how that might determine the strength of that collaborative. So we can have a deeper conversation, Rodney, about if you think your collaborative is formed enough yet to work towards your system change. But that piece should be pretty firm with clearly identified partners, their roles clearly identified. And again, if you look at those characteristics on that slide, those are really what we're assessing. Thank you, Rodney.
All right, thank you.
Any other questions that we can answer through this live Q&A? Feel free to continue to put your questions in the chat room if you're not in a space to go on mute, or if you want to have those reflected in the FAQ for later.
I have a question about the health outcome. Should the health outcome be really specific or can be really general? For example, if we're trying to change those community infrastructure such as parks, and then we try to promote those access activities for the general public, and then the health outcome can be really general, right? Is that okay?
Yeah, I think as specific as you can get, especially when you're thinking about the elements of a healthy community and say if you're working on food systems and the health outcome that is with ensuring food security, say. So being really specific with that, especially if you have specific data that shows a disparity in those specific health outcomes. But we recognize and hope that the systems change that is working on, it may be for a targeted population, a more specific population or community, but that the broader system and the broader population might be impacted. So I think it might be wise for your LOI to focus specifically on a clearly identified health outcome, but perhaps the larger potential for those more population-driven health outcomes. It's kind of like a public health model, if you will. So looking at populations, but then the individual effort as well.
Thank you.
I have a question.
Sorry, Elizabeth, just really quickly before you answer or you ask your question, if any of my Vitalyst colleagues that have a bit more public health lens to answer the question as well, you're welcome to come off of mute. But Elizabeth, will toss it to you for your question.
Yeah, I only heard part of it when you're covering it, that the grant cannot be used in programs for direct support if we provide direct support. Can you clarify that?
Yeah, certainly your collaborative can work in the direct service or more programmatic space, but the grant itself is meant for systems change. So if your LOI, we usually look out for buzzwords, especially in our one-on-one conversations. And if you mention something around programmatic work or an expansion or startup of a particular program to improve health, we really look at the systems change and not so much the direct service or programmatic support that goes into the great efforts that your collaborative or your organization might be working on.
Okay, thank you.
That also doesn't mean just to like Control F for find wherever you put program in your LOI and substitute, say, the word project. We really assess if the proposal is truly related to some sort of policy, systems, or environmental change and not direct service or programmatic support. If you do want to explore more of those efforts, there might be some other Vitalyst resources that don't directly support like direct service or programmatic work, but maybe build your capacity or something. So you can look at other Vitalyst resources that may be a better fit. Logan, my friend, hello. Oh, you're still on mute. You get the prize for the first one.
I'm the one that did it. It's good to see you, David.
Mm-hmm.
I have a question about the budget. So like how final / specific does the budget have to be with the LOI? Because if the applications aren't actually due until I believe it's January or December, I can't remember exactly, but there's a long time frame in between there. So like how final does that budget need to be, or can it be pretty general?
I think the budget can be pretty general. There is a spreadsheet that we use for our full application that you're able to kind of outline more specific budget line items that the grant would cover, and of course the budget narrative. We really need enough information where the budget in the LOI clarifies that it matches the scope of work, So if it's simply $175,000 to pay for a facilitator to harness the collaborative's system change work, that's probably not generally enough. So I think as much specificity as you can in your budget would be to your advantage, but it doesn't have to be completely firmed up. Also, we recognize that systems changes. The efforts towards systems change changes. So we work really collaboratively with our grant partners, and certainly can with you as you go through the process. If change is needed to your budget, and we could work with you to amend the proposal, or if selected for the actual systems change grant, we work collaboratively with our grant partners to make any alterations as needed throughout the grant period.
Thank you. And I sort of had a second question that kind of aligned with that, is when we're talking about the community partners that we are working with, do you suggest that that money from this grant is also shared with those community partners, like in a sort of like highlighting that aspect of it as well?
It certainly can. A lot of previous proposals, and it's allowable, highly encourage, especially with an equity lens, to provide stipends or honorariums for community members that are part of the collaborative. So you can definitely utilize the funding to cover those expenses with community partners. And there was something else that I wanted to hit on this point, but it escaped my mind. So I'll think about it and include it in the FAQ. Oh, subcontractors. That's what I was going to say. So in certain instances, very similar to kind of sharing the resources with community partners, especially holding an equity lens. The funds can be utilized for consultants or contractors, facilitators that are often important for systems change, and that subcontracting capability is open in that sense as well. So the contract may be with them, but the funds can go towards other contractors, subcontractors that are helping in the effort as well.
Another question that came in the chat was, can universities lead or be part of these collaborations?
Universities can lead and certainly be part of the collaboratives. Again, just like a previous question, we really try to hold an equity lens and ensure that the community partners are taking a lead in the application and in the system change efforts. But recognize sometimes it is an institution that takes the lead. In the past, we have had kind of varying success to working with institutions just because of the increased bureaucracy that comes with grants and within institutions, but have had lead applications serve as the systems change grants before. We have a great partnership down in Tucson that 2 or 3 years ago now through the Southwest Folk Life Alliance, and they have great community partnerships working along 12th Avenue in South Tucson, if you're familiar. And the U of A was the lead applicant. Another example is that ultimately kind of separated to provide the funds directly to the community partners was with the Southwest Interdisciplinary Research Center at ASU. So we do have experience working with lead applicants being in institutions, but really encourage you all to try to position the community partner as the lead in an authentic way, not just because.
And David, we have our colleague Marcus on the line who said he could provide a little bit of additional context to the health outcomes question. So,
I was hoping Marcus would
Marcus.
Thank you, my friend. Maybe you're still on mute, Marcus.
He called in, so I think he's working on unmuting maybe.
Can you all hear me now?
Yes, sir. Thank you.
Testing. Oh, okay. Nice. 2 unmute buttons. So David, I actually think you did a really good job of summing up the health outcomes question that someone proposed. Mm-hmm. If the question is coming from a place where you're asking whether or not Vitalyst Health Foundation wants you to identify the exact degree of impact you're going to have after 3 years on a community's A1C levels, or you're going to decrease obesity by 15% after 3 years, That's not the level of detail that we're expecting. What we're hoping to see is some sort of evidence-based connection between the system change you're looking for and health outcomes. And when we say evidence-based, that could mean secondary literature that shows that, you know, housing has a really strong tie to somebody's health outcomes, or something of the sort. We don't need to see exactly the specific degree of health impact that you're going to have, but we do want to see it connected through evidence-based research, or even through evidence that is gained from community insights, having worked in this area for a specific amount of time.
Love it. Thank you, Marcus. Much more eloquent than I could ever, and we'll make sure to capture that and have it reflected adequately in our FAQ document as well. We're at the top of the hour, and I recognize I'm standing between you and your Labor Day weekend. So hopefully you all are able to wrap up your work. And thank you again for taking time to learn more about the Vitalyst Systems Change Grant and our cycle that is now open. Again, we invite you to discover partnership, and if the System Change Grant is the best resource that Vitalyst has to support your efforts. Again, we'll post this recording, the slides, and an FAQ document on our webpage, hopefully by the end of today, but maybe early next week. And if you have any questions, don't hesitate to reach out. Thank you all so much for all of your efforts across the state of Arizona, and we look forward to being in touch. Thank you so much.